ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
I think it's been, something that has been transforming lives here.
The COVID-19 pandemic is making it difficult for many to access healthcare. Telehealth is breaking down some of the barriers. This is ncIMPACT. I'm Anita Brown-Graham. Welcome to ncIMPACT. COVID-19 is affecting our jobs, our schools, our lives. This crisis is leading us to revisit some important statewide topics that COVID-19 has caused to have increased importance in the state. This week, we're rethinking the topic of telehealth. Joining us is Maggie Sawyer with the North Carolina Department of Health and Human Services, Dr. Steve North with the Center for Rural Health Innovation, and Calvin Allen with the Foundation for Health Leadership and Innovation. Calvin leads the Rural Forward program. Our panelists have lots of interesting ideas about our new way forward with telehealth, and they want to hear your ideas and your questions. Telehealth has become a lifeline during the COVID-19 pandemic, but many communities in North Carolina had already embraced this way of delivering healthcare even before the crisis. ncIMPACT's David Hurst reports.
Why don't we take a look at her ears?
Fiber optic is having a significant impact on healthcare in the Tipton Hill community.
I have chills and a headache.
Those who live in the Mitchell County town can go to this telehealth clinic run out of a local community center.
How about a sore throat?
Patients can be checked for non-emergency issues at the clinic rather than making an hour drive to the nearest medical center.
We know nationally that people who live in rural communities tend to have poor health outcomes, and access is a major barrier. And so folks tend to not go to the doctor as often. And it's not because of a lack of interest in their own health, it's the burden.
Cool, thank you. The telehealth clinic runs on Country Cablevision's fiber network. It allows patients to see a healthcare provider through video conferencing with cameras and specially equipped medical instruments.
We would not be able to do this without the fiber optic. We rely on those speeds, so I think here it's 100 megabytes per second down and 5 up. It also allows us to have the video clarity that we need to look in an ear, or the audio clarity to really hear if that's a heart murmur or not. And I think that previous attempts at telehealth have been somewhat limited by the signal quality that you can generate through a T1 line or a much slower connection.
Maggie Sawyer, thank you so much for being with us. I've been surprised at how many people have asked in recent days, what is telehealth? Could you explain what it is for us, and can you distinguish between it and telemedicine and digital health?
Thank you, and thank you for having me here today. I'm so thrilled to have the opportunity to address this topic. And I'm going to add on to the specific definition, and what I mean by that is Secretary Cohen, because of her commitment to equity as well as access to health and everything, she's begun to tell us at the department that really the access, it's now about health, right? That however you access it, whether it's a video or telephonically or whatever, it's about access to health. But going back to your question, telemedicine has typically referred to sort of that clinical application of medicine for a clinical visit. And when we look at telehealth, it includes a wide variety of services that are not just medical. It can be anything from patient education to opportunities to do interprofessional education. In today's world and in North Carolina, we have people who are doing physical therapy, occupational therapy, medical, visits, in addition to all these other things, and getting, I think, remarkable results because people like being able to see where folks live and what they're facing.
So talk to us a little bit about how COVID-19 has changed the use of telehealth. I read recently a staggering 1 of 8 people has used telehealth in the last month. What does it look like in North Carolina?
Oh my goodness, we have seen, so let me just say that COVID-19, for all of the things that are very difficult and the challenges it's presented, has really created an opportunity for people to think about embracing this as a way of making sure that people get access to health. So it's been providers, it's been patients, it's been communities, and so that has increased exponentially across the state because now, quite frankly, we're paying for those visits at the same rate that we are paying for office visits. And heretofore, people wanted to do this work. However, if you're not getting paid for those kinds of visits, it restricts the opportunity for people to provide them. So you see a whole new group of people who are interested, and I think because people are interested, they've done FaceTime, they've done Zoom visits with family and all of that. I mean, I have relatives now that are 92 and 97 years old who are embracing this.
We've got a bunch of questions that have come in from our audience. Let's take one from Heidi in Hickory. How can telehealth be as effective as an in-person visit if no one is there to take your vitals or evaluate you?
So some of these questions I think can be very better answered probably by Dr. North, since he is a physician and does this work. But they can use different technologies to actually look into, as I think you heard earlier, look into people's ears, looking at vitals and different ways of being able to do that. And really, the clinicians, the doctors are the ones who are able to really look at this and validate the usefulness of telehealth. And I think Dr. North will certainly validate that.
Thank you. Well, let's go ahead and bring Calvin Allen into this conversation for a moment. Calvin, you've been working in communities all across North Carolina on health issues. Are there some communities that are more reluctant than others to utilize telehealth? What are you hearing?
Absolutely, and I think it's a mixture of curiosity and a little hesitance. What is this thing? It's this new technology, and anything new, it takes time to get used to. One quick pre-COVID story that I think is relevant is there's a community hospital that we work with in Eastern North Carolina where we were hearing reports about folks who were refusing ambulance rides that were 5 minutes from the hospital that were Latinx, and instead waiting for their friends to drive them 45 minutes to an hour and a half away. And it was because the hospital that was close by only had options for somebody across a screen. There was nobody introducing them to what the technology was and how it worked, whereas there was a known entity and somebody that was trusted by the community further away. So thankfully, this hospital recognized the need to do greater outreach to bring the community in and help guide them, and they've made tremendous changes since then. So I think kind of keeping those things in mind as we do more telehealth, telemedicine as well.
How would you work with a community to really use telehealth to penetrate and offer services to people who may have had no services before?
The community education part is kind of the first step. And so, and actually, let me take a step back. The true first step is making sure that there's access. And we know that in terms of rural communities and communities that have been more in the margins, even in urban areas, that it's really important to have access to broadband. And that has been never clearer than the past few weeks, where folks who did not have service before are feeling more and more isolated. So making sure that there are broadband services available. Then number two, the great thing, unfortunately, about a lot of North Carolina having gone through several hurricanes and natural disasters is that communities have come together. They've figured out kind of how to work together to improve their behavioral health, to improve their food systems. There are wonderful, amazing examples that have happened all over North Carolina related to people gathering together, and especially that infrastructure has been essential over the past few weeks to provide services in completely brand new ways. So community groups that were meeting monthly are now meeting weekly. They're using Zoom, they're using FaceTime, they're working together kind of across sector. The folks in behavioral health are coming up with helpful flyers that then they're putting in food baskets that are distributed across communities. Okay. This is happening in McDowell County, Edgecombe County, Beaufort County, Halifax. Everybody has kind of come up with their own innovations to make this happen.
Love that. And of course, we're going to come back and talk about telehealth as it applies to behavioral health later. Right now, I want us to look at an important application of telehealth. As schools remain closed, more school districts may look to virtual options that allow students to see a doctor whether they are at school or, as the current case may be, at home. Let's look at a telehealth program in McDowell County.
Hi, Meredith. I'm good, thanks. How are you?
Healthy Schools is a school-based telehealth program that makes it possible for kids, as well as faculty and staff, to receive healthcare services where they spend most of their time at school.
Yeah, I've got Luke here. He's not feeling so good today.
We have really good healthcare providers in our community. We just don't have enough of them. And so while they do wonderful work, they might not have enough slots in their schedule.
She could turn you on and say,
Kids who would otherwise not receive any care have access to care.
Take a deep breath, Luke.
It doesn't require the kid to be out of class, because they can sit in class and wait for the prescription just like they could be sitting at CVS and wait for it. So we're able to get the teaching done at the same time with making sure that their health needs are taken care of.
Okay. I started school nursing itself 19 years ago, so 19 years ago I would never have thought that we would be doing it quite this way. Oh, the kids love it. They're like, oh, this is cool, I can't wait to do that, or that's so neat, and especially if they get to see inside their ear, things like that. It's like, wow, I didn't know that. So they really like that. Okay, Luke, you're gonna have to pack up and go home with strep positive, and we'll let Mom know to come get you, okay?
It's inexpensive, it's easy, it's a no-brainer in a lot of ways, and I would like to see Healthy Schools available to every kid in every school, at least in North Carolina, if not all over the country.
Thanks, Meredith.
You're welcome, thank you.
Let's bring Dr. Steve North into the conversation. Steve, welcome to ncIMPACT. Healthy Schools is now in 105 schools in 9 counties, and you provide access to over 54,000 students. I had to read that to make sure I got all those numbers right.
No, yeah, absolutely true.
Give us some idea of how schools are coping today with serving the needs of their students who are at home.
Yeah, it has become a major challenge. Many of the students that we see through Healthy Schools don't have access to care through traditional medical systems due to a variety of reasons that range from immigration status and being undocumented to transportation and insurance. Even though a family has a high deductible health insurance plan, that does not mean that they can afford the $150 it may be for a regular office visit. And Healthy Schools is able to see those kids without needing to receive reimbursement from the families. We have a very generous sliding scale, thanks to the support of many programs across the state. So those students right now are not receiving care regularly. We are seeing some intermittently through video, but our volume has dropped from 15 patients a day in February to maybe 15 patients a week right now. I think that as we go into The summer, our services typically slow down. However, next fall, depending on what things look like, we will need to reinvent ourselves and see how we can meet the needs of students wherever they are learning across the state.
As our provider on the panel, I'm going to give you this question from Amy in Raleigh. The question is, can providers do all the same things using telemedicine, and is patient privacy protected? Really important question.
Those are great questions and have come to the forefront right now. So in this time of COVID, we need to talk about what telemedicine is first. A video interaction like this is absolutely telemedicine, but I'm limited in this setting in a way that I'm not in our schools program, because I can't listen to the heart and lungs, I can't look in the ears, eyes, nose, and throat. So there's a limitation there, but I'm still able to do almost everything except, as one of my colleagues likes to say, palpate and smell, which when you're seeing a 14-year-old boy who is overloaded with Axe body spray, it's okay that you can't smell him some days. Depending upon who's presenting, it is possible to have them do the palpation, for example, a school nurse. But the issue of privacy and of confidentiality is a particular concern to me as we are providing care to kids, adults, our elderly patients across the state via telehealth. I have the ability to ask someone to step out of the room here at my office in Spruce Pine. However, that changes a little bit if I'm asking mom or dad to step out of the student's bedroom. So hopefully they will do it. They do it here. But when you're in a single wide trailer with your 3 siblings and mom and dad all home all day, it's really hard to find a private place to discuss confidential issues, regardless of if you're the student or the parent.
Calvin, let's toss the next question to you. It comes from Anna in Valdez. Given what we've heard Steve North talk about, her question is, how can we encourage more school-age students and their parents to take advantage of telehealth, especially during COVID-19?
Well, I think we saw, in the piece that David did, that Luke was excited about telehealth. He was curious about the equipment. I think exposure is one of the major pieces that makes all the difference, and we talked about that a little bit earlier. So I think having opportunities where students are given kind of an orientation to what is telehealth, what does it look like, what are the components of it, and being able to share that also with parents, they're able to address some of the questions that they have directly, to talk to folks like Steve who've been doing this work for years and can address any concerns that they have.
Thank you. Let's look at another important application. Behavioral health is going digital amid this COVID-19 pandemic. ncIMPACT looks at how the Franklin County Sheriff's Office uses telemedicine to treat those with mental health conditions.
Prior to video conferencing, we just went once a week and did a weekly clinic in jails. But it was clear that just once a week isn't enough for a jail, that often they will get a detainee in all of a sudden who's acting bizarrely, unstable in some way, and need an assessment much more quickly than waiting a week.
We've had some to come in here, we'd had to keep in a padded room. They were so bad. Since Dr. Coy has had several sessions with them, in their tenure here, we hadn't seen them back.
The inmates are now getting the treatment that they once weren't getting, and they're stable. We're able to manage them better, and the environment of the detention facility and wherever they may be is better.
When a person with mental illness comes into a jail, they're not going to get a therapeutic intervention from an officer. It's just not the officer's role.
Without medical records, we can't do much of anything. And so it is important that you have a psychiatrist that is able to identify issues with the inmates and then make a diagnosis and treatment. We're not doctors, we're not nurses. You do have a nurse on staff, but to have a professional psychiatrist is much greater.
We are a group of psychologists primarily, and our role is to address the needs of the client, the detainee that we see in the jail, and then ideally through this stepping up process, try and navigate a way for them to get out of the jail when they're in on a nuisance charge. That's the real effort, is to be able to navigate them out of a legal setting that's not really appropriate for them and a healthcare setting that is.
Calvin, before we get to the subject of telehealth, you work in a lot of communities like Franklin County. Share a little bit about how you see the stress of COVID-19 affecting mental health.
I think all of us, there's so many unknowns, and I think we've been hearing from folks in community that not knowing when things will change, if we will go back to exactly kind of how we were. It's created some anxiety and depression, and providers are seeing and hearing from folks. We're also dealing with folks who may have had substance use issues in the past that had created some healthy ways to address them, that might have been going to the library or interacting with somebody that helped them, and they don't have access to those things anymore. So this is something that's become a huge issue kind of over the past few weeks.
Thanks. Dr. North, Moreo in Gastonia has asked, are telehealth therapy sessions as helpful for mental health as they are for face-to-face sessions?
I think that in any situation, it is the skill of the provider at engaging via telehealth. There's almost a level of showmanship that one needs to use. And additionally, the willingness of the client or patient. But the evidence, when you look at this on a research basis, shows clearly that it is equivalent care. And in areas where it's impossible to reach someone, or situations where the stigma of going to the behavioral health center is so great, that being able to see someone virtually is ideal.
Let me stick with you for a second. I've got a question from Robin in Durham. The question is, does telehealth offer the possibility of expanding availability of pediatric mental health care? Does it work for children?
So yes, it works for children, and it works very well. There's, again, good data to support that. The challenge is having enough providers. So pediatric psychiatrists, there are not enough in our state for the needs. So perhaps there are no more visit slots, whether it's available virtually or in person. But for routine therapy, absolutely it's great and could improve access, because rural communities may not be able to support a full-time pediatric therapist, but it could be shared across 3 or 4 counties.
Maggie, let me go to you for the next question. Thank you, Dr. North. Eric in Charlotte wants to know, how do we see the growth in telehealth varying by geography and by primary versus specialty care?
That's a great question. And I think it's important to tie that back to a previous discussion you had on ncIMPACT, I think, which was around broadband. And when you look at specialty application of telehealth, some of that is going to differ depending on the specialty and what's needed to fulfill that particular service based on, let me give you an example. I have a cousin who's in Australia right now, and he serves women in rural Australia who are high risk pregnancy. And his ability is dependent on broadband to be able to see the details of that visit. So I think the expansion of this, certainly I think primary care is the place where we've been able to see it most quickly, because there are a variety of things that we can do. I think you have to look at each specialty to be able to look at that in additional detail. I will tell you, however, that there's a group down in Mount Olive that works with us as a rural health center, and there's a piece of equipment they're able to use, and they've trained their staff to capture a digital image of the eye that they then transfer to an ophthalmologist who can then say, what's happening with this patient as a diabetic. And they're able to use that without having people leave the community. So I think you do have to look at it by specialty as to what those needs are.
Well, Maggie Sawyer, Calvin Allen, Steve North, I want to thank you so much for being with us. Thank you for watching and engaging. There are solutions out there if we work together. If you think of a solution or have a comment, visit unctv.org/ncIMPACT. Coming up on ncIMPACT.
I didn't see an issue in what I was doing, but you have to crash sooner or later.
Our state is facing an opioid crisis, and staying home during a pandemic can bring new challenges. We'll look at what is being done to promote wellness in our state.
ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.